Hello, this is Dr. K, hair transplant surgeon from Turkey, and I'm going to talk about hair transplant in Turkey in general. So how things work in Turkey and what are the differences of the system here compared to, let's say, the Western countries like Europe or United States. Turkey has become the center of hair transplants in the last couple of years, and there are a few reasons for that. Turkey has become the center of hair transplants in the last few years. There are approximately 1,000 hair transplant procedures performed every day in Turkey, and the annual revenue made from only hair transplants has exceeded $1 billion. Now, what are the reasons for this? Now, the first reason it's cheap. So, why is it cheap? The reason why is that labor in some countries is much cheaper than others. So that's one of the reasons. The other reason, and perhaps more important, is that it is allowed in Turkey to use much cheaper labor than it is in other countries. For instance, some parts of the surgery can be performed by technicians, nurses, so this decreases the overall cost of hair transplants. Now, some of this is legal and some of this is not entirely legal, but cheapness is a huge attraction for international patients who come in every day for hair transplants. Now, there's approximately 1,000 hair transplant clinics in Turkey. Most of those clinics are called technician clinics. These are clinics where there's no doctor involved in the procedure, and 99% of the procedures are done by technicians. Now, of course, this is not entirely legal, but the system here allows a doctor supervising the procedure and technicians doing most of or even all of the surgery. So this allows for offering multiple surgeries per day by each clinic, which also decreases the costs even more. There are clinics that do 30, 40 surgeries per day. Some clinics will do 2 or 3 operations in just one operating room per day. Given that each surgery normally takes 7 to 8 hours, they speeden up the process so that they finish under 5 hours and they can do 2 or 3 of those surgeries per day. There are clinics that work, they have night shifts. They work 24 hours so they can do more surgeries. Basically, this is how it works. Now, since there's a huge demand for having a hair transplant in Turkey, internet marketing becomes very effective. So these companies, they advertise with a significant budget on the internet, and then they get thousands of inquiries. So because they sell so cheap, they sell a lot of hair transplants. And because they don't need a doctor in the surgery, there are companies that will do 30, 40, 50 surgeries per day. So what they do is they rent a hospital flat, they divide it into small rooms, and then 2 technicians each perform hair transplant procedures. And sometimes the same team performs 2 or 3 surgeries in the same operating room. So they do it so quickly that they finish 2 or 3 surgeries in one room. And as I said, there's companies that do 30, 40 or 50 surgeries per day. And this cycle goes on and on like this because more revenue generates more marketing budgets, and more marketing budgets generates more inquiries, and more inquiries turn into more patients, and so on. Now, for the very few doctors, there's a handful of doctors that actually have boutique clinics like mine, these kind of have to swim against the current because the doctor does most of the procedure, they can do less patients a day. For instance, in our clinic, typically we do 1 or 2 patients a day. Because we do more of the work and we do less patients a day, our price becomes more expensive. The doctor's price becomes more expensive. Because it's more expensive, less patients choose the doctors. Because less patients choose the doctors, there's even less patients. And because there's less patients choosing these doctors, there's a much smaller marketing budget that can be used for advertising. So a smaller marketing budget means less customer leads leads to less patients, and then that vicious cycle goes on and on against the doctor clinics that actually want to do it properly. And it favors the clinics that just use technicians to do the whole surgery. And this system is going on and on for many years now. So a question comes to our mind: what are the results of these hair transplants done in these technician clinics with no doctor involved? Of course, most of them are not good results. However, these patients generally don't make a significant official complaint. Because these hair transplants are so cheap, patients tend to see it as a shot for nothing, which I believe it's not, but they just give it a try, and then once it doesn't work, they just accept the fact and they just kind of leave it as it is, which also kind of helps the system go on as it is. The clinics that do multiple surgeries per day, thousands of patients per month, they need to only sell one hair transplant to one patient once. They don't need the patient come again, so they don't need direct referrals. Once they do the hair transplant, it doesn't matter if the patient is happy or not, they've made the money and they move on to the next patient. Now the doctor's clinics work on reputation, so the doctor has to be very careful, has to take care about their quality and the results. So if the results are not excellent, the doctor will pay the price for that as negative results and perhaps even negative reviews and less referrals. Whereas the technician clinic doesn't need any referrals. It just depends on its own internet marketing. And so this system goes on, and there doesn't seem to be anything that's going to stop this from happening. Thank you for watching this video and see you in the next one. Goodbye for now.